Hi, it's Chris Little here, news director at KFI, and I'm talking with Dr. Ira Byock. He's with Providence St. Joseph Health, and we're just going to find out a little bit about him and what he stands for and what he's bringing to the community. Thanks for joining me, sir.
It's a pleasure to be with you.
So, what is it that you're doing with Providence St. Joseph Health?
Oh, just trying to transform healthcare.
Well, and it's interesting you say that because I know that that is actually true. That is something that Providence St. Joseph Health is trying to do.
It's true.
What is it specifically that you are involved in?
American healthcare gets some things very right and other things not right. We get disease treatment really well done here in America. We bring the very best of science and technology to find out what's wrong with people and then to fight that disease, to try to correct the pathophysiology that's making people sick. What we don't get right is realizing that wrapped around each disease, there is a full human being with feelings, with the need for comfort, with the need for their emotional, interpersonal, social, and even spiritual well-being to be attended to. And that in America, we almost assume that if we treat the disease, well-being will be a byproduct of fighting that illness. In fact, that's not quite what happens.
Right. So you're talking about whole person care then.
You bet. We're trying to acknowledge in a very formal way that every human being is a whole person with the need for good diagnoses and treatment, but also with the need to attend to how they are feeling. You know, good care starts not just with asking what's the matter with you, but it starts with asking what matters most to you.
We're talking with Dr. Ira Byock with Providence St. Joseph Health, talking about whole person care. Dr. Byock, what is it that you specifically deal with?
I have the privilege and pleasure of leading a group within Providence St. Joseph Health called the Institute for Human Caring. And what we're doing is bringing sophisticated change methodologies, metrics, or quality measurement, and systems change techniques to make the right way the easy way, to make it easier for busy clinicians and our exceedingly busy American healthcare system to see the dimensions of personal experience that American medicine often just ignores, not through ill intention, but just because we're so solely focused on people's diagnosis and treatments.
So it seems so simple. You're talking about making the right way the easy way.
Yes, exactly.
And how are you going to do it?
So we're doing it by using nationally promulgated standards or best practices in internal medicine, in cancer care, in cardiology, in surgery, and we're saying let's embed that within our own clinical metrics for our health system. Let's make the medical record make it possible for busy clinicians to see what matters most to people. Who they would want to speak for them if they became seriously ill and unable to speak for themselves, where they value things like living as long as possible versus being at home as much as possible rather than being in a hospital if they were seriously ill. All those sorts of things seem second nature to you if you're a patient or a family, but in a busy healthcare system, we tend to simply assume that you're there solely to get your disease treated, and it doesn't matter how much time you spend in the hospital versus at home or with your family.
Isn't that what most people are there, though, for, is to get whatever illness they have treated and then to get out of that hospital?
The fact is, this is not mutually exclusive. We can walk and chew gum at the same time. We can bring the state-of-the-art disease treatment to help people cure their illness or live longer with their illness while still concurrently attending to their quality of life.
We're talking with Dr. Ira Byock, and he's with Providence St. Joseph Health. And earlier you mentioned best practices, and that made me think about best care possible. And we've spoken about in the past here when I've been speaking with people from Providence St. Joseph. We've spoken in the past about best care possible.
You bet.
What is the best care possible for somebody, for instance, with Alzheimer's or Parkinson's or any of the myriad of diseases out there that seem to linger?
The best care possible is what every one of us wants. If you or someone you love becomes seriously ill, you want the best care possible. but what that means is different from one person to another. Most of our American medical system and culture looks at the best treatments for disease, and there are flow diagrams or clinical algorithms that we can follow to know what tests we should order and what treatments we should prescribe in what sequence.
Right.
The fact is that an illness is not just medical, it's personal. So the best care for someone with Alzheimer's disease or Parkinson's disease involves allowing them to have access to the best treatments, but also in a way that is consistent with their personal priorities. The best care for one person may mean being on state-of-the-art, cutting-edge treatments as long as possible, even if it means being in a hospital most of the time and being in an ICU during the last part of their life. For another person with the exact same illness, it might be a very different model. The best care for them may mean being at home as much as possible and using medical care when it makes sense to them, but not excessively, so that they can spend time with their family, with their grandchildren, in familiar, comfortable environments. They're both the best care. I don't know, when I meet a new patient, I don't know what the best care is for them, but I know how to define it, how to determine what it is. It starts with asking them what matters most to you, and it starts with listening. That's something that we're trying to make normal within Providence St. Joseph Health, but is not really reflective of the way that most doctors and health systems treat patients today.
Well, most doctors and health systems don't have the time to treat patients the way you're describing how they maybe need to be treated or want to be treated.
The fact is that it takes less time over the course of a patient's illness and their life to do what they want rather than provide the most treatments possible to everybody. It takes more time up front when you're first diagnosing and creating plans of care, but the health system saves a lot of time on the back end when they're caring for people. More often than not, people will say they'd rather be home,
Right.
spending their last weeks with their family and loved ones, while in America, there is a real push in the health system to sort of direct seriously ill people to the hospital, to the ICUs. I mean, 20%, 1 in 5 Americans now die in an ICU. Very few of us actually want to spend our last days there. The large majority of us would like to be at home, surrounded by people we know and love and who love us.
And I don't want to dwell too much on, the type of care somebody really wants or the doctor thinks the person wants. But I guess I say that to say this: how is it that everybody can get the care that they need? Because I may need specialties and
Of course.
All kinds of money spent on me, but I don't have it.
So the economics argument is simply fallacious when applied in this way. You know, we Americans spend more per capita, far more than any other developed country to provide health care to each one of us. Yet our outcomes are nowhere near the top. We are ninth. The Economist says we're ninth among developed nations among giving care to people through the very end of life. Right. It doesn't take we could provide much better care while still saving probably 15% of the enormous amount of money our country spends on health care if we were simply to do it right, meaning give care that is highly personalized and consistent with people's values, preferences, and priorities, rather than just looking at an algorithm and providing the most diagnosis and treatment possible.
We're with Dr. Ira Byock from Providence St. Joseph Health. And what is palliative care, and how do we incorporate that, into the care of all patients?
Yes, good question. So palliative care actually grew in America from hospice care. You know, hospice was invented in the 1960s in England when Dame Cicely Saunders looked around and said, "Why are people dying so badly?" And she brought a team approach with physicians, nurses, social workers, chaplains to really attend to people's needs, their physical needs, their pain control, but also their emotional, social, spiritual needs. Mm-hmm. In the 1990s in America, I and many other physicians and other leaders in healthcare basically ask the question, why do people have to be dying to get this level of care? And we really developed palliative care, which is a team approach to care for people within the context of their families that addresses their physical, emotional, social, and spiritual needs. Well, it's turned out that multiple studies have shown that when you surround somebody who has cancer or heart failure or liver disease with palliative care in addition to their disease treatments, so we're seeing people concurrently with their cardiologists or their oncology teams or their intensive care teams. When you do them both together, quality of care soars. People live as long or longer than they would have lived without us, and people are happier. Additionally, costs drop. They don't rise with this concurrent care model because people are getting the care that they want, but crises happen less commonly and the like, right? We're keeping people out of the hospital. We're making their hospital stays shorter. Nowadays, at Providence St. Joseph Health, we've asked the next question. Why do people even have to be seriously ill to get this level of care, right? And we're creating something called whole person caring so that you're getting attended to by the people who can work with your primary care doc or your specialty oncologist, cardiologist, whatever, nephrologist, whatever it is, while attending to your comfort and quality of life, not just your physiology.
Why is it that palliative care and whole person care aren't really the norm?
You know, nobody's at fault here. The American healthcare system grew up around assuming that people were here to treat their quote unquote problems, right? And we have focused all of our attention and a lot of our healthcare dollars on the science and technology of disease treatment. But it turns out that illness is not just medical, it's personal. If you or someone you love is seriously ill, it becomes very apparent. Every time I read a memoir of a physician who has had his or her own illness or his or her spouse or father or mother's illness, within the first few pages, there's this moment where the author says, I realized that this was personal. And they realized that they were sort of doing it wrong in their practice all of these years, giving the best disease treatments, but forgetting that this is somebody's life. And that life happens in the context of families and communities, not in healthcare. So it's not, nobody's at fault, but we're all responsible for fixing this.
Right.
You know, we can do it better. And there are examples of places that do it better. I mean, frankly, you know, my wife is Canadian. I have many relatives in Canada. While the Canadian healthcare system has lots of problems, it actually does it better than we're doing it here. Despite what people may think, Canadians get state-of-the-art disease treatments. They really get excellent medical care. But they get medical care in a way that is more personal. It's still not perfect, but it's more personal than care is in the United States. And, by the way, they do it at about 2/3 the cost that we spend here in America.
Well, aren't there a lot of arguments about long waits, things like that?
You know, that happens occasionally, but in all honesty, I have, 15 Canadian relatives. It's not that bad. The waits aren't quite that long. And if somebody becomes seriously ill, they get in just like that.
There's been a lot of focus on repealing the Affordable Care Act here in the United States. How will that have an effect on health care?
So I'm one who doesn't think it's a particularly smart move. I think the Affordable Care Act was, in fact, more bipartisan than many people believe.
Right.
I mean, it really did start with Romney Care in Massachusetts and was developed from that base. And, even without the law, the insurance companies want to go in this direction. The big thing about the Affordable Care Act is paying for value, not just for volume. In other words, not paying for the amount of medical care you're getting, paying for the quality of the outcomes that medical care delivers. That's something that the Aetnas and the United Healths of the world and the Blue Crosses of the world are all have been saying is the right thing to do. Medicare climbed on board through the Affordable Care Act, but most of us in healthcare and most of us who have been leaders in healthcare think that this is an inevitable way that we need to be moving anyway.
You mentioned that's the way the insurance companies want to go. Do you mean managed health care? Because when we think that's the way the insurance companies want to go, everybody thinks, well, the insurance companies don't really have our best interest at heart. So are you talking more about managed healthcare? That's the way they want to go? Or are you actually talking about
I'm talking
insurance?
about quality. I'm talking about value. I
Okay.
think this is one place, believe it or not, where again it used to be bipartisan, where all of us used to agree that better quality is what the goal here is, and I think
Seems
that
logical.
right. So the insurance companies are on the hook for the costs, but notice that they keep pushing excess costs to those of us who pay for health insurance, right?
Right.
The employers, but also all of us as individuals. The fact is the way through this is to focus tightly, laser focus on what is better care and pay for that, not simply how much care a healthcare system can deliver.
If everything works the way we all want it to work, it would seem that doctors aren't pitted against patients and nobody is arguing with their providers. Is that something that will happen?
Yes. In fact, in a healthcare today, we're including the not only patient experience but nurse and doctor experience as metrics for quality. I mean, the open secret is that doctors these days are an unhappy lot. I mean, doctors are feeling burned out as much as any profession. Our rates of alcohol and drug abuse, of depression, of suicidality is as high as any other profession in America. Part of the reason is that it's not much fun to be practicing these days, and we often feel like we're doing things to people that are not in our patients' best interests.
We're talking with Dr. Ira Byock with Providence St. Joseph Health, and you're just talking about how there's a lot of stress, all kinds of issues with doctors in healthcare. What's taken so long to get to the point that you and others have said, hey, we need to change things?
I think it's been a lack of leadership, frankly, and because in the dominant healthcare system, the fee-for-service healthcare system, where doctors and health systems have been rewarded for giving more care than people often needed and giving as the most care possible rather than the best care possible. It's been a long time in these corrective actions coming to the fore. Now what we're seeing, and I think I'm proud to say that I came to Providence St. Joseph Health because of the leadership that they're showing in improving the quality of health care. We're actually pulling up our big boy pants and saying, the way we've been doing things in American healthcare is not the right way. Let's do it well. Let's actually take care of whole persons and do it in a way that lives our highest values. At Providence St. Joseph Health, we have this promise statement. We answer the call for patients who say, know me, care for me, ease my way. That resonates really strongly with me and many of the doctors in our health system. We really want to know our patients as whole persons and then deliver on that promise to care for them in ways that are highly personalized and ease their way.
Everyone I've talked to involved with Providence St. Joseph Health has been very passionate, as you are, and as I said, others. However, it still seems like you have an uphill battle. When I was a kid, I used to try to sweep water up my driveway with a push broom. It kind of seems like that's what you're trying to do. Every time you get a little up, it comes down on the other sides. How do you continue to fight the good fight?
So I've been in this business a long time. I helped stand up hospice and then palliative care in the United States. It has been a very uphill battle. At this point in time, because of the sea change in the way healthcare is being paid for and will be paid for in the future, I'm feeling more hopeful than I have ever before. I think that while I may not be in my professional role to see us cross the line to the next, healthcare 3.0, I think we're well on the way to making improvements in healthcare that really meet people's needs. I have to tell you, in a sense, though, we need the American public, we need everybody listening to us to get on board and demand not just better care, but much better care. I mean, those of us in my field of hospice and palliative care, my clinical field, have been standing on a two-legged stool. We have proven that much better care is possible, and we've proven that you can do it while actually reducing total health care costs. The third leg, which has been missing, is citizen consumer demand. People are afraid of things like hospice and palliative care when they should be demanding the type of care that represents the highly personalized care that addresses not just my disease, but my subjective well-being, my experience and the experience of my family.
Why do you think people are afraid of hospice and palliative care?
Oh, because it's associated with dying, and we don't want to talk about it. It's like superstition.
Well,
We think
it happens, though.
there's this modern superstition. If you bring it up, people say, "Oh, don't talk like that." Oh, I want to stay positive. In over 35 years of clinical practice, I learned that not talking about it doesn't make death not happen. It just means that when you're dying, it's likely to happen in a way that you would not have wanted, in ways that are harder than it might have gone.
So a lot of people consider it a culture of death.
Yes, and I think absolutely falsely so. I mean, really, I often ask people, would you, rather live as long as possible or as well as possible, right? You know,
Right.
would you rather, be happy or live fully? Woo,
That's a tough question.
that's a tough question.
Would you rather be happy or live fully?
For me, I'd rather live fully, because happiness is elusive, and it's often transient. Frankly, we may have an inalienable right to pursue happiness, but it's hard to sustain. Life is hard, but living fully, that's possible.
Are you living fully?
As much as possible. I'm here talking with you, and it's a joy.
Yeah, thank you. Last question. Given all these barriers, are you still, do you still believe, or are you still hopeful for whole person care? I mean, obviously you believe in it, and I guess I'm asking my question just because of the smile on your face. You are hopeful for whole person care, I would say.
I'm seeing it beginning to emerge, and I think I am seeing some recognition dawning in the patients and their families that we care for, where they're understanding that healthcare can be much more personalized, more humane, and that they don't have to sacrifice the best treatments possible for the best care possible. So yes, I am hopeful.
So in one sentence, tell us how we can make sure that we have the best health care possible.
First and foremost, recognize that when you're diagnosed with a serious illness, this is personal. It's not just medical. So stay in charge. Ask your doctors what they're going to do for you. Make sure that you know who to call after hours if you have a problem that is new to you, that you need help for. Don't be afraid to ask hard questions of your doctors. Don't be afraid to change doctors if you need to. Get 2 or 3 opinions if you're seriously ill. Make sure one of those opinions is with a palliative care team, so that you're getting the best state-of-the-art care for your comfort and quality of life, as well as what ails you.
I didn't think you could answer it in one sentence. I do have a question for you, and I'm just because it's a tough question to answer. But when you talk about changing doctors as a doctor, does that hurt your ego? If I come say to you, "Hey, I want another opinion, or I want a new doctor."
This is a service profession. I went into this profession to care for human beings. This is not about me, and I want people to know. And I've written books for the general public. I write editorials for the general public at all the time. I speak a lot to the general public, and I want to emphasize this is about you, right? The doctor's there to serve you, not the other way around. So ask hard questions, and yes, if you need to change doctors, do so. This is about you and your family getting the best care possible.
All right, Dr. Ira Byock from Providence St. Joseph Health, thank you very much for your time. I appreciate it.
It's been a pleasure talking with you.